Doesn't the blame reside with Jewel?
Is it now our top terrorist threat?
With the right people.
So you have for
has been in operation since January at the Turk Street location, and because we have needed to expand and we brought in a number of city employees, which are disaster service workers for our city from various city departments to help expand our operation, we moved here to Moscone South in an effort to meet what we know will be a significant challenge for our city as it relates to the coronavirus. We are on day 3 of the shelter-in-place order, and we have this operation center here fully operational with a number of city departments who are working together to make sure that we are prepared and coordinating in our hospitals, that we are working to prepare with our homeless and vulnerable populations, that we are working to provide information and safeguards and other things in a very timely manner to residents of the city, that we are communicating with businesses that are basically ordered to shut under the direction that we provided but have not done so. We want to make sure that we don't take for granted that everyone has the information, so we want to get out there, be proactive, and communicate to a number of businesses and people that we see out in the community what the order entails to provide clarity on that order. And just to, just communicate to the public that we understand that this is, of course, quite challenging for so many people. But this is not a vacation. This is not time for social gatherings. We want to discourage the gathering of large groups as much as possible. Shelter in place, of course, means that you and your family members and the people who are part of your household are the only members in that household. So we are discouraging play dates and dinner parties and other things that typically you would maybe want to do in your homes, but this is really about slowing down the spread of coronavirus, and it's about making sure that we at least have available to you some of the essential needs that so many people might have. So that's why the grocery stores, the pharmacies, the cannabis clubs, the gas station, the banks, and places that are working on this particular issue, like our hospitals, our fire stations, and our police stations, the essential city services and resources are available. But we want people to shelter in place, to stay at home if at all possible in every single instance. That is how this is going to work. So we do understand that this will be quite difficult. We are on day 3, and there is still uncertainty. This is an evolving situation, and as information is provided to us, we make a decision as to what is in the best interest of the people of this city. We are up to 70 confirmed cases of coronavirus now, and as you can see, it continues to rise. And we want to make sure that we are prepared. We want to make sure that we definitely flatten the curve. And you hear this talk about flattening the curve. That is real. The goal is to prevent anyone from getting infected with the coronavirus. That's what this is all about. We don't want to inundate our hospital system. We don't want to create challenges with people who may not be able to self-quarantine. We are here to ensure that the city is ready and prepared to deal with any challenge that comes our way. And we can't do it without your help, without your cooperation, without your support and your understanding, and definitely your patience. So at this time, I want to introduce the Director of the Department of Emergency Management, Mary Ellen Carroll, who will give you an overview of this Emergency Operations Center that has many dedicated city employees who have really stepped up to provide a level of support to respond to the coronavirus crisis that's here in San Francisco. Mary Ellen.
Thank you, Mayor Breed, and thank you for being here today. I want to thank the mayor for her steadfast leadership during this pandemic. Her foresight in taking early action and unwavering support of our emergency managers, our healthcare professionals, and our disaster service workers, many of whom are here in this building today. Protecting the health and safety of San Francisco is and has been our most important responsibility. The novel coronavirus situation is changing rapidly, and San Francisco needs to continue to be aggressive so that we can flatten that curve and disrupt the spread of the disease and protect community health. To reiterate, all San Franciscans can do their part to help protect the most vulnerable residents by staying at home, practicing good hygiene, and checking on people by phone who might be isolated. We are grateful to everyone out there who are following the orders and taking these measures. But there are many of us here within the city that have to go to work so that essential city services can continue. And this includes first responders, healthcare workers, and emergency managers. These people are on the front lines of the COVID-19 response, and they are dedicated to the health, safety, and well-being of our residents. And we are many here in this building today. So we have been preparing since January when we elevated our Emergency Operations Center to focus on preparing San Francisco for the novel coronavirus. And much of our early work was on establishing situational awareness and educating the community on the virus. On February 25th, in coordination with the Mayor's declaration of emergency, we surged our Emergency Operations Center with emergency managers and disaster service workers from across the city and city departments to accelerate our advanced planning and operations. We are now at our highest level possible. We have dedicated so many San Francisco government employees to this effort that we have had to relocate here to Moscone Convention Center South. This is where we have the space to work, but also in this unique situation, we need to have social distancing even when we are here together working. Here, we're working with all of our partners to fight this pandemic, and we continue to support essential city services that need to remain open. So what are we doing here? This includes supporting essential city personnel, ensuring city services have the resources that they need to maintain regular cleaning, and helping agencies outside of the city and in the city that provide essential services to continue. This EOC, Emergency Operations Center, will continue to support the efforts to shelter and care for people impacted by COVID-19 and vulnerable populations. We will keep the work being done here going every day until we get